introduce yourself and check their identity. Next, explain the procedure to the patient and get consent. Once you have done this, ask the patient to empty their bladder. Then, ask for exposure by saying, "I would like you to expose your belly. Is that okay?" You should then ask the patient to position themselves such that they align comfortably on their back.
Check for tenderness and superficial palpation by asking my patient.
Okay, Emma, so now I'd like to examine your tummy. Is that okay with you?
Okay, yes.
Alright. So this examination will involve me looking at your tummy, touching, and also listening to your baby.
Okay.
Okay?
Yes.
For this purpose, I'd like you to expose your belly.
Alright.
Would that be okay with you?
Yeah.
Alright. And also, I'd like you to lie down on your back comfortably.
Okay.
Alright. Also, before we start the procedure, we just usually advise the patient to empty their bladder.
Oh, alright. Yeah.
Are you ready then?
Yes, please.
Okay, shall we go ahead?
Yes.
Alright, thank you.
Before beginning the procedure, ensure that you have the following equipment: a fetoscope or pinhole stethoscope, and a measuring tape. Next is obstetric palpation. This is to check for the lie of the baby. You will need to use both hands, but inform the patient that you will be pressing firmly. However, remember to be gentle. You should stabilize one side up with one hand and palpate with the other. Use a snaking movement while palpating. Once you have felt one side, you will need to repeat on the other side. Again, remember to stabilize that side with one hand and palpate with a snaking motion with the other. You will need to feel the structures when you palpate. For the back of the baby, you will feel a broad curved structure. You can repeat this motion 2 to 3 times to ensure that you are familiar with the structure that you are feeling. If you feel the limb, you will feel an irregular structure. Now, you will need to feel for the upper and lower pole of the abdomen. So beginning with the upper pole, you will move your hands together while palpating. You should also check for the consistency. If this is the head of the baby, the consistency will feel hard and the structure will be round. Now you must repeat on the lower pole of the abdomen. If the structure that you feel is soft in consistency, then that would mean it would be the buttocks. Next is the visual fundal height. First, find the pubic symphysis. Next, measure up till the fundus. You can place the measuring tape between your fingers, as shown in the video, to help measure the fundus. Ensure that you measure in centimeters, but when measuring, make sure that the inches face up and the centimeter down to avoid being biased. The fundal height must match the gestational age. For example, 36 weeks must match 36 centimeters plus or minus 2. In this example, 34 to 38 centimeters when measuring would be normal. If your measurement is less for the date, we may suspect oligohydramnios, intrauterine retardation, or wrong dates. If the measurement is large for the date, we may suspect a large babies in a case of diabetes, twins, a wrong date, or polyhydramnios. Now, you should begin the procedure by performing inspection. As you expose the patient, ensure that you expose them adequately above the waist, but do not expose the breast. Now, you should be looking for discharge, redness, swelling, sinuses, scars, uniform distension of the abdomen, and any cutaneous signs of pregnancy such as linea nigra or striae gravidarum. Next is palpation. Now that you have completed your examination, you should be able to tell the lie of the baby. It can be longitudinal, transverse, or oblique. You should also be able to tell the presentation of the baby. If you feel the head in the lower pole, this means that it is a cephalic presentation. If you are able to feel the head in the upper pole of the abdomen, then it would mean that it is a breech presentation. Next is a check for the engagement. There are two methods to do so. The first is to insert the fingers between the pubic symphysis and the presenting part. If you are able to insert your fingers, this means that the head is not engaged. If you are unable to insert your fingers, this means that the head is engaged. The next method is a paulic grip. This method can only be used if the presentation is cephalic. To do this, you would need to hold the head between the thumb and the index finger. You then have to perform ballotment of the head. If there is ballotment, then it means that the head is not engaged. If there is no ballotment, then the head is engaged. Next is auscultation. To do so, you will use the fetoscope. First, you will need to locate the head of the baby. Then you will need to locate the back of the baby. This is to know where to place the fetoscope. You can place it on either the left or the right, but on the same side as the head, either above or below the umbilicus. For example, if the back was on the left and the head was below the umbilicus, we would auscultate as shown in the video. If the head was on the upper pole, we would auscultate as shown in the video. We would listen for 15 seconds, and then we would multiply the number of beats we hear by 4 to determine. We would then thank the patient and then press the patient.